Thank you very much, and thank you everyone for appearing today. First of all, there's been a claim that Hyde is somehow to blame for delays in medical care, but the state of Illinois did a study from 2013 to 2016 that actually 752 Illinois enrollees, Medicaid enrollees, died while waiting for care. So this is a problem with Medicaid in general, not necessarily with the Hyde Amendment. Dr. Parrott. Well, with regards to home rule, you have to take that up with the U.S. Constitution. But I would, and Madam Chair, I asked to offer into the record a article from the National Review entitled "A Flawed Study Claims That Few Women Regret Abortion," that discusses the problems with the Turnaway study.
So ordered.
Okay, so Dr. Parrott, I think it said somewhere in your history that in your bio that you're licensed in Maryland. So I'm sure you're aware that in Maryland, there really is no functional barrier for Medicaid women to have abortions. Is that right? Dr. Parrott?
That question is misleading. There are a number of barriers to accessing abortion care in the state of Maryland.
Okay, well let's go through the figures, because in 2017, only 18% of Marylanders were covered by Medicaid. But 27% of the abortions performed in Maryland were funded by Medicaid. So actually a disproportionately higher number, and you and I both know it's through the mental health loophole, because in the last year the data is available of the over almost 8,000 Medicaid funded abortions, and it was funded through state funds. I agree, Maryland agreed to do it. But in Maryland, there actually is no functional barrier to that. Is that right, based on the statistics?
No, that's incorrect. The patients that I talk to every day can identify any number of barriers to accessing care. You mentioned barriers to accessing care through Medicaid more broadly. The same is absolutely true for accessing care to abortion.
Okay, but the figures will show that, in fact, a higher number of Medicaid patients actually have their abortion paid for with public money, albeit state money, but public money nonetheless. The risk to health, I assume, and I think the chairwoman mentioned the risk to health, but in fact, in Maryland, the data is that it's all mental health. Now, Dr. Parrott, I don't know if you've ever done an abortion in Maryland or done it on a Medicaid patient with a mental health referral, but are you aware that an abortionist who claims that there is a mental health issue does not have to refer for mental health care? You're aware that requirement does not exist, is that right?
Well, I'm aware that patients are in the best position to decide whether or not continuing the pregnancy would pose long-term mental health impacts to their life. And the patients that I take care of, I talk to them about that, and I believe them when they say that this is something that will be harmful to them. I trust their response and their view of their health.
So, Dr. Parrott, globally, is that the way you feel about mental health care, that basically we don't really need it because people can kind of decide what is in their best interest or not? That's a rhetorical question. You don't have to answer it.
I'd be happy to answer it.
No, but that's okay. It's you don't need to. Christina, could you go over, because you mentioned the problems with Planned Parenthood, and obviously, I wish Planned Parenthood, which is a C3, the money they got from selling baby body parts, I wish they had actually funded abortions free for some of their clients. But you mentioned the sexual abuse issue, and we know that there are numerous reports of Planned Parenthoods providing abortions when the client has said they're underage, and, for instance, the father is an adult. Is this what you're referring to, Christina?
Yes, that is actually what I'm referring to. Specifically, I'm referring to a study by Live Action, which is an organization that I work with, who has talked to different women who've been abused. And unfortunately, that's been covered up by Planned Parenthood. And they have a report that you can find online called Aiding Abusers, where it goes into that information. I personally, as I mentioned before, I live in Connecticut, which is a state that does not have parental notification laws. So that means that minors are allowed to access abortion without even notifying their parents. And at the same time, we are in a state, like many states across the country, where we have horrible reality of sex trafficking, where women are being taken advantage of. And it's not hard to understand that for women who are taken advantage of through sex trafficking, for them to be able to keep those girls and those women in business, they have to make sure that they do not keep their pregnancies. Obviously, they become pregnant because they are being raped brutally over and over again. But one of the ways in which they make sure that they can go back to business is by taking them to abortion providers. And it's easier in states like Connecticut, where there's no parental notification laws, because then traffickers and pimps and abusers can take underage girls to get abortions, and there's no questions asked. And so this is a reality that we don't often like to talk about, but it's horrible.
Thank you. I yield back.